Good afternoon, students. So today topic is the zoology second year, chapter unit 5th B, that is the reproductive health. So generally, the topic lesson name is the reproductive health or there. So generally our body organs, so many organs are there. So each and every organs also can maintain the good health condition are there. So any the failure are there, the organ, it finally causes to the disease. So at the same time the reproductive organs also are present in our body. In male body, male reproductive organ, female body, female reproductive organs also there. So these also to maintain the healthy condition are there. So when sometimes the healthy condition but not maintenance are there, it is causes to the some disease. So what the disease? That is the first question are there. Short answer question first one. Briefly describe the common sexually transmitted diseases in human beings are there. So some diseases are there. That is the sexually is a transmitted are there. So when the illegal contact with the other persons are there, then sexually through the diseases can transfer are there. So this is the very important 4 marks question. Sexually transmitted disease, that is called STDs. So disease or infection which are transmitted through the sexual contact or there, through the sexual contact. So when one of the person through the disease, how it is the spreading from one to one or there, that is the sexual contact or there. So for example, so many diseases can attack or there. So some diseases can attack by the parasites or there, viral or there, directly can attack into the body or there. For example, nowadays is a COVID virus or there. COVID virus is attack into through the respiratory pathway damage or there. But this disease sexually can contact or there, sexually contact or collectively called as sexually transmitted diseases or there, or venereal diseases, venereal diseases, or reproductive tract infection. Only the reproductive tract area part that is causes to the infection. Right. So most common sexual transmitted diseases and their causative organisms and shown in the table are there. So which type of disease can attack? It is caused by the which organisms are there. That is the disease and your causative organisms are there. So these diseases can affect into the reproductive tract area. Gonorrhea, Diserium gonorrhea, it is the one bacterial disease are there. Syphilis, Treponema pallidum, it is bacteria are there. Genital herpes, it is the herpes simplex virus, it is a viral disease are there. Genital warts and cervical cancer, it is caused by the human papillovirus. Are there. Trichomoniasis, it is a parasite. Trichomonas vaginalis are there. It is affected in the protozoan parasite in female body part, in vagina part are there. Chlamydiasis, trichomatis are there. It is a bacterial disease are there. Hepatitis B virus. Hepatitis B are there. It is caused by the HPV virus are there. Hepatitis B virus are there. B virus, C virus are there. Types of virus are there. Finally, that is the HIV infection. That is called AIDS disease are there. It is caused by the human immunodeficiency virus. Next 4 marks question. Second question. Write the short notes on any two of the following are there. Here IVF, IC, SI, IUDs are there. That is the ART are there. That is assisted reproductive technology parts. So first one is the in vitro fertilization and embryo transfer are there. So generally some persons affect but there is no child after marriages are there, but there is no child production are there. So where the problem is located, or male body, female body, how it is the child production are there. Some assist the ART, the generally fertilization are 2 types. In vivo fertilization, in vitro fertilization are there. So generally in vivo fertilization means the fertilization are present inside the body is called in vivo fertilization. When in vivo fertilization but not there, some any demerits are there inside the body, but this person how it is the child production are there. So another techniques are there, that is called IVF technology. IVF technology are there. In vitro fertilization are there. In vitro fertilization or embryo transfer are there. But fertilization takes place from the outside of the body in the laboratory. After the embryo transfer to the mother body, that is called in vitro fertilization. Here, how it is are there. In vitro fertilization, how it is how it is are there. Fertilization of ovum by sperm. Fertilization of ovum. The female can release the egg or their ovum by sperm done outside the body. So then inside the body fertilization is properly not there or failure. Sometimes in male body sperm count is very low, or female body but sometimes that is the egg is not developed, or some fallopian tubes problems are there. In this time, so another techniques are there. The fertilization takes place from the outside the body. So outside the body of a woman is called in vitro fertilization. This in vitro fertilization, how it is are there. The resultant embryonic stage with generally 8 blastomeres is transferred into the mother's uterus for further development. Embryo transfer or intrauterine transfer are there, IUT or ET embryo transfer are there. So this how it is are this fertilization how it is are collected the sperm and egg in this method, which popularly known as that is called test tube baby. Generally that is called test tube baby procedure. So generally any one of the mother body, the ova from the wife or the female donor, and the sperm or husband or male, it is collected from some injections, it is collected or there. Egg and ovum collected from the body, and this egg and sperm, the sperm and egg, the fertilization with outside the body collected, mixed, induced to the from zygote under the simulated condition are there. Almost similar conditions are present in the same method are there inside the body or laboratory method, but same are there. When the mother but not the failure are there inside the body part, fertilization is not accept are there but failure are there. So this type of condition, how it is the child produced are there, that is called test tube baby. After the fertilization takes place from the outside the body up to 8 cell stage, the blastomere. When the blastomere 8 cell stage are there, this blastomere can implant it into the mother body of uterus are there. If the mother's uterus is not medically fit to receive the embryo, so why this method is accepted are there? So mother bodies but not accepted are there. Mother body can any problem are there, or the fertilized embryo can transfer into the another person body. So medically fit into the receive the embryo procedure in vitro, it can be implanted in the uterus another woman. So for example, one mother can donate the ova and the father can produce the sperm, but mother body part there is no cooperate with the uterus problem are there, the embryo problem are there. So in this time, this fertilized embryo blastomere is implanted into the another person woman, that is called surrogate mothers. That is called surrogate mothers willing to carry this embryo are there, or this type of technique or applicable are there. Second one is the intracytoplasmic sperm injection are there. Cytoplasmic sperm injection are there. So generally any one of the person's sperm count is very low are there, but sperm's motility is very low are there. In this time the ICSI technique are followed are there. This is another specialized procedure in which the sperm directly injected into the ovum. So where the sperm count is very low are there, sperm's motility is very low are there. So where the egg is located, so the highly qualified doctors or highly trained nurses are there, collected the sperms. So where the egg is located, directly can inject into the female body are there. Microscopic needle to form an embryo in the laboratory are there. Or later embryo is transferred into the uterus. So after fertilization, the embryo is transferred into uterus or fallopian tube for further development purpose are there. This method is employed to assist and couple where there are some problem. The sperm such as decrease. So this type of techniques which can take are there. The sperm's count is very low are there. Decrease or in the sperm count are there. So these persons can use this type of technology that is called intracytoplasmic sperm injection. Next one is the intrauterine devices. So generally, any one of the person can delay the produce of the offsprings or postpone to the produce of the offsprings or one child to another child the gap. So maintain some gap. So which type of devices are to maintain are there? That is called intrauterine devices are there. So these intrauterine devices mainly helpful to stop the fertilization or prevent the fertilization, the egg and sperm. So one child to another child, generally doctor advised to the minimum 3 years or maintain are there. One child to another child are there. So in this time, how it is the prevent the pregnancy. So that is called some intrauterine devices techniques methods are there. These devices are inserted into the uterus by doctors or highly trained nurses through the vagina part are there. So different type of IUDs are there. Non-medicated IUDs are there. Just only lipase loop are there. Copper releasing IUDs are there. That is called copper T. That is the oral contraceptive pills are there. Copper 7 multi-loaded are there. Hormone releasing IUDs are there. Progesterone. So LNG 20. So these devices or IUDs are ideal contraceptive to female who want to delay or have the space between the children. So this type of techniques can you maintain are there. IUDs techniques are maintain are there. So it prevent the fertilization or stop the fertilization are there. So this is also important for